I'm Dr. Becky, the creator of the Science-Based Plan for Wellness. Each week, I'll be talking about how to have a healthy lifestyle through healthy eating, physical activity, and behavioral changes. How can something so fundamental and to human existence be so darn complicated? Each week, I'll be explaining to you how to have a healthy lifestyle. There's a lot of misinformation about diet and wellness, and Americans don't know who or what to believe. I'll be explaining, dissecting, chewing up, and spitting out the answers to this quandary so you don't have to work so hard at it. This is not an infomercial. There are no magic supplements, no unsustainable rapid weight loss tricks. There's no extreme anything, just the knowledge and the resources to live a healthy life. First, let me tell you a little bit about myself so you can feel reassured by what I'm about to serve you. Instead of a ladder, I've climbed a bonsai tree. In 1978, I entered the medical field as a nurse's aide. Since then, I've climbed from a registered nurse to a board-certified obesity medicine specialist and OBGYN. Along the way, I've earned degrees in biology, that was a master's degree. That was a bachelor's degree, psychology degree, and that was the master's degree, and an RN. While I was taking care of patients, I realized that a lot of women struggled with their weight, just as I had, and they had problems with their energy. So I started to take the necessary work to become board certified as an obesity medicine specialist. Along the way, I learned how to eat properly, control my own addiction to sugar, and to lose the necessary weight to have a normal BMI, and now I've been able to sustain that for over 5 years. This program is based and founded in that knowledge that I gained during the obesity medicine coursework. You will learn scientifically proven ways to live a healthy life and to lose weight. I'll stick with the evidence, detangling the food industry's marketing ploys that tend to interfere with anyone trying to eat for optimal health. Although comprehensively designed, this plan is very simple to follow and easy to execute. Each week, I'll be presenting 2 of the 4 different eating options: healthy eating out, grocery to go combos, lickety-split prepared home meals, or gourmet prepared home meals. Actually, there's a 5th option, and it's a protein meal replacement. And today I'm going to present a very berry protein shake that can be used as a meal, or and it's considered a meal replacement. And then the other meal today is from Wendy, so one of the healthy eating out options. Physical activity advice. Today we'll discuss how to calculate the intensity of your exercise. There will be a behavioral tip. Today is low on fuel, let's hydrate, and there will be a science section and story time, where I'll share a sample of the latest research that's been presented on this topic. Fact or fat? Eating before you go to bed is bad for you. You shouldn't go to bed hungry. However, if you can fast overnight for 10 to 12 hours, you'll have weight loss and more burning. There'll be a greater burning of fat. So when you sleep, the liver stops burning carbohydrates and it starts to use fat as the fuel to get you through the night. So while we sleep, the majority of our fat burning occurs, and I talked about this last week, during the REM sleep. So it's preferable for you to fast overnight. Eating high fat or protein within 3 hours of sleep can interfere with your natural or your internal sleep clock. On the other hand, if you're hungry when you go to sleep, it can also interfere with your sleep quality. So eating a well-balanced meal for dinner can offset and prevent you from having a low blood sugar about the time you go to bed. If you need a snack, this is one of the times that we recommend a carbohydrate only snack. And I think a banana is a good choice because, or a half a banana, because it's gentle on the stomach and it's not going to probably cause any kind of heartburn, or if you would happen to have a little bit of that back up in your esophagus while you're sleeping. So the banana is a good choice. Exercise contributes to better sleep, but for many people, if you exercise, especially if it's aerobic exercise, within 3 hours of bedtime, that can also interfere with your sleep. Of course, alcohol can interfere with the quality of your sleep if it's consumed within 3 to 4 hours before you go to bed. So good sleep hygiene is really important. So the room needs to be very dark. We found that the blue lights that come out of our cell phones and our laptops decrease the melatonin, which is a natural hormone that's released from the brain that helps us to fall asleep and stay asleep. So cutting out all blue light and excess light at the time before bed can be very important and helpful. Melatonin starts to go up around 10:30 in the evening and peaks around 1:30 in the night. So it's best to try to get to bed and ride that wave of falling asleep and staying asleep. So as I've mentioned before, if you need a snack before bedtime, you should have a snack. So yes, is eating before bedtime bad for you? Not necessarily. Recipe for health. This is one of our meal replacements. We found that many Americans don't eat breakfast, and we believe that's because either they consume too many calories the evening before, maybe right before bedtime, or they are sipping on a sugar-laden frappuccino or a drink that has a lot of sugar in it and maybe has some appetite suppressant in it, such as coffee. So when we look at how to help people eat a breakfast, or at least a healthy meal supplement or replacement, we found that these protein shakes can be very beneficial. So today I'm going to put together a completely balanced protein meal replacement. I actually had this for breakfast myself, and it is delicious. It's a 400 calorie meal. So what I found over the years to make the production a little bit easier on your protein shakes is to put the water in first. So this is a cup of water. You could use a half a cup of water and a half a cup of ice if you'd like. I'm using frozen berries. If you have fresh berries, you can use more ice. And then I've already pre-measured out this 1.5 scoops of protein powder. Now, as you can see on the screen, I've that I use either Walgreens or Giant brand. I've chosen these two because I analyzed them based on the amount of amino acids and the types of fat. You don't want too much fat, and you don't want the wrong kinds of fat. Now, in order to make this completely balanced and to get the proper amount of fats, at least the healthy fats, I'm adding in the flaxseed. And I've talked about the flaxseed before. This is a ground flaxseed. It gets about 3 tablespoons worth. And it's all omega-3 fatty acids. These are the fatty acids that are helpful for the heart. They're anti-inflammatory. And then we're also going to add 1 teaspoon of pure honey. Now this is grade A honey, even though I got it from Dollar General. I made sure that it was the type that has been proven to help with your gut microbes. We've discussed gut microbes before. In this particular meal, we have berries, which are natural prebiotics. We have the honey, which is a natural prebiotic. And then, as I mentioned, the flaxseed is the healthy omega-3 fatty acids. So we're going to have to use our imaginations today because I mixed up a drink this morning, consumed it, enjoyed it, and then forgot to mix up the final product for the show. So just use your imagination, run that through the blender, and you will have a very creamy, very berry drink. Now, this could be swallowed in a very short period of time, but for all of our meals and meal replacements, we recommend that you take your time drinking it, that you do mindful eating or drinking. In this case, sometimes in the morning I'll get this ready before I start putting on my makeup and doing my hair. So I'll take it up and I'll be drinking it as I get ready, but I'm always mindful of the taste and I take my time. It takes about 20 minutes for the stomach to send the signal to your brain that it's finished consuming the meal, or it's that you're full. So you want to take your time. You don't want to suck this down just because it happens to be a liquid. So this is a good choice for breakfast, but you could actually use it for any meal replacement throughout the day. And it's very easy to create and very delicious to consume. So, does this meet the American Diabetic Association diet? Check. The American Heart Association diet? Check. Health done right? You better believe it. Okay, so next we're going to, next we're going to discuss physical activity. Last week we discussed mild intensity and moderate intensity exercise. I mentioned that the Department of Health and Human Services guidelines recommend 150 minutes of moderate intensity exercise per week to decrease your risk of chronic disease. But what is moderate intensity exercise? If you don't know exactly how many METs you're creating with your exercise, how do you know if it's mild, moderate, or vigorous intensity? If it's mild activity, you will be able to continue your conversation, but you won't notice a change in your heart rate. Moderate intensity exercise, you can still have a conversation, but you can start to feel your heart rate go up. So when you're out walking, if you don't feel like your heart rate's going up, then you're probably in the mild intensity range. Then vigorous intensity is when you cannot carry on a conversation, your heart rate goes up, and your breathing goes up. So when you're trying to determine the intensity of your exercise, you can use those couple parameters to decide whether you're mild, moderate, or vigorous intensity. So a metabolic equivalent is the measure of oxygen used by the body at a period in time. And every time you increase your activity level, you raise the amount of oxygen that's being consumed during that period of time. And like I said, we're looking for moderate intensity exercise for most of your exercise. Next week, what I'm going to do is I'm going to teach you how to calculate your target heart rate, because that's a little better way of knowing exactly whether you're in the range for the getting your heart rate up into a range that's been shown to be beneficial for your heart. So up here, last week I put up the mild and the moderate. So today we have up the vigorous intensity exercise, which is 6 or greater METs. And hiking, especially if you're going up a hill, that's a pretty good workout. Jogging. Now, I don't know about you, but if you're out running on the road, you really don't know how fast you're going. If I look on the stationary bike, I can see how many miles per hour I'm going. But when I'm out just jogging around, I have no idea. And this is where those other parameters, like you're having trouble breathing and your heart rate's up at that point. But the target heart rate will also help because you can stop your running at that time and calculate your pulse and then determine whether you're in your target heart rate range for your age. So exercise is important. We've discussed that. Any and all exercise is beneficial for your overall health, and we're going to be working on trying to get your intensity up so that you can have greater health benefits. Change your habits, change your life. Today we're going to talk about the importance of hydration. Low on fuel, hydrate. Hydration is essential to life. Drinking enough water is the cornerstone of healthy living and an important factor which affects your energy, your digestion, and even your mood. Water is the lubricant that keeps your body running. A healthy person can survive for weeks without food, but even the fittest person can only survive a couple days without water. Let's take a look at one of the world's favorite drinks, coffee. Coffee, taken in moderation, has many health benefits. Coffee increases metabolism and fat burning. Coffee affects our gut peptides, and these are the hormones that affect our hunger and our sense of fullness. Coffee consumption decreases our risk of diabetes, and this is what we call dose dependent, or it depends on how many drinks you have. You need to have 3 8-ounce drinks or cups of coffee a day in order to decrease your risk for diabetes. And if I remember the number, it's about a 58% reduction in diabetes risk. So regular moderate coffee drinking can lower the risk of gallstones, colon and liver disease, and even decrease the risk of Parkinson's syndrome. On top of this, coffee has more antioxidants than fruits and vegetables. At the end of the show today, I'm going to be presenting a Decadent Iced Coffee recipe for you to add to your coffee repertoire. Green tea has many of the same caffeine benefits as coffee. Green tea also contains a flavonoid called catechin, which is a powerful antioxidant, and this is used and helps with appetite, and also because it's an antioxidant, it decreases your risk of cancer and cardiovascular disease. This has also been shown to help burn abdominal fat and to rev up your metabolism. So you'll see on my plan, you'll be given a lot of tea drinks and coffee. Many people think fruit juice is a healthy choice, and even though it does, if it's pure juice, it can have a lot of nutrients and vitamins, but because there's so much sugar in fruit juice, the sugar component outweighs the benefits of the nutrients. So you shouldn't consider fruit juice as a healthy choice. It's not one that you should consume on a regular basis, and surely you shouldn't consider it as a necessary fuel. Remember, changing habits take time, so allow yourself the time to make small changes. Use what we call SMART goals. S stands for specific. So if your goal's not specific, then you're less likely to be able to attain it. So if you say, I'm going to cut down on my soda consumption, how do you determine whether you've really cut down on your soda consumption? So if you say, I'm going to have 1 soda per week instead of 3, that's easy to be specific about. Next is M, measurable. Again, if you say, I'm going to cut down without setting a number, then you won't be able to measure it. A stands for attainable. So if you say you're going to make a change, but you know that it's not likely to happen, say your sister always offers you a soda when you come over for Sunday afternoon dinner, and you know she just lost her job, and you're probably not going to decrease that soda because of how it makes her feel if you cut out that soda. So make sure that your goal is attainable. And then R stands for realistic. if you don't like plain water and you say, I'm going to consume more water, or I'm going to consume 4 16-ounce glasses of water a day, but you really despise water, if you don't put in something that makes it so that water's enjoyable for you, you're less likely to be able to attain that goal. And T stands for timely or time-bound. Giving yourself a time span, in other words, over the next 4 weeks, I'm going to be able to decrease this by this amount. And you have to say, starting tomorrow and within this time period, or we have a tendency just to put off our goals if we don't specifically state what the goal is. So use SMART goals when you go to change your habits, and certainly in this situation, by changing your liquids, you can change your overall health. Okay, the science of health. This is an interesting study that came out of the University of Indiana, and it looked at the relationship between a group of individuals' BMI or weight and their access to fast food and healthy supermarkets. So this was the largest national study ever conducted on the connection between residential environments and BMI. What they found is that fast food is generally not good for you, and supermarkets do sell healthy food, but our results suggested blocking the opening of a new fast food restaurant or subsidizing a local supermarket will do little to reduce obesity rates. I'm not surprised by this finding. We do know that there are a lot of healthy choices at restaurants, and people eat unhealthily at home. I've seen some of the recipes that people place on Facebook, and I click on them and they look relatively healthy until I see the amount of oil that was dumped in, or the amount of cream, or the amount of sugar that was added. And so I'm not that surprised by this result. I will say that if you can control the intake of what goes into your food, you're more likely to have a healthier option. But my next meal is going to come from Wendy's, and then you will be able to see how I am able to take a restaurant meal and make it into something very healthy. But first, story time. We've been talking about Allie Vincent and her roller coaster ride, and I talked about how she won the Biggest Loser contest and how she lost over 40% of her weight. Then she put it all back on, and how she was very tearful, and we talked about why her metabolism was down. And then we looked last week at some of her current emotional state, responses to her emotional state, and how she wanted to eat. She joined Weight Watchers, but I haven't been able to find any results from that. And then in November of 2016, she started a diet bet program. And so what it is it's called At Diet Bet, and what they've designed is games that seriously motivate and make it fun to lose weight. So people bet on whether they can lose a certain amount of weight. Now, monetary rewards have been shown to help with short-term weight loss, but it has not been shown to be beneficial for long-term weight loss. So the $250,000 that Allie won in her first on The Biggest Loser did help her lose it, but it's not what has been shown to be helpful for long-term benefits. So Allie, I bet if you follow Health Done Right, you will lose your weight and get control over your food and have a healthier lifestyle. Next, recipe for health from a healthy dining out place. And as promised, we've got Wendy's. Actually, last night, I had this exact same meal. I wanted to make sure that it was as tasty as it looked. And it is a small chili. I added 1 pack of the hot chili sauce. I think they have a mild one, but I didn't ask them when I stopped by. But I put in 1 pack of the hot chili sauce, and this is a small chili. Of course, this has the beans in it that are considered resistant starches, so they're slow to get digested by your body. This is a grilled chicken wrap. It has a honey mustard sauce on it, and I'll tell you, it was very, very tasty. And then they have these apple bites. So you can finish off your meal with what we call the new dessert. Fruit is the new dessert. And this is a large glass of diet green tea. I'm sorry, just diet black tea. You can add in your artificial sweetener if you would like. And this is a healthy meal. The carbohydrates are the perfect amount to keep your blood sugar stable. So does this meet the American Diabetic Association diet? Check. The American Heart Association, it depends on which guidelines you're looking at. If you're looking at the strict guidelines, no, but it has less than the 7 grams of saturated fat, which is what the national recommendation is for fat, and it does not have any trans fats. So does it meet the American Heart Association? Probably. Health done right? You better believe it. Okay, so sometimes the perfect ending to a long, full week is hanging out, at your local brewery. This beverage is actually one that can be used as an alcoholic beverage, but I would recommend it for breakfast or for throughout the day. Now, I usually just brew up my coffee in a coffee maker, but this was a recipe that I found online, and I decided to try it last night. So, as you can see, this is one that you just use water, you put the coffee in it, you put it in the refrigerator, and the next morning you strain it. Now this recipe actually asks for you to strain it through a coffee filter. I just used one of my small strainers, and it worked fine. Of course, you don't want to add any sugar. This has a sugar-free syrup in it. If you wanted to add some alcohol, you could, but certainly this is a great choice for a healthy coffee, and as we've discussed, coffee has a lot of health benefits. Now, we've talked about the 3 drinks a day. There's a couple side effects or negative effects of coffee that you need to be a little bit careful of. It can cause some gastritis or a little bit of heartburn, so sometimes it's beneficial to add a little bit of sugar-free creamer or to have it after a meal. Some people get heart palpitations because it is a stimulant, and you have to be careful if you try to wean yourself off of the coffee. So you have to keep your coffee intake at a stable amount. I have 3 cups of coffee a day. I have them about the same time every day. I use them for the health benefits. My friends will tease me and say, Rebecca or Becky, isn't it 4:30 and time for your coffee? And I use it in a scheduled manner so that I don't get any caffeine withdrawal headache. And I also use it to help with the energy level and help with the metabolism throughout the day. I'm very careful not to add any additional calories. I use an artificial sweetener. If you like your coffee black, by all means, don't add anything to it. But you really don't want to change a healthy beverage such as coffee into an unhealthy sugar-laden beverage, which then increases your storage of fat. So enjoy this Decadent Iced Coffee drink. We are at the end of this week's show. Ready to change your life? We're looking for a few folks who are willing to try the whole entire comprehensive program from the healthy eating component to the behavioral changes and the physical activity part. Thanks for joining in. I hope you've learned something that you can take on your journey for health and wellness. And before you make any dietary changes or physical activity changes, please consult with your healthcare provider. See you next week, same time, same place. Do you have a healthy lifestyle question? email me at drbecky'shealthdoneright@gmail.com, and I'll be sure to respond to that question. Don't forget, being healthy is a choice. Until next week, here's to your health done right.